recording. Is that right?
We're streaming as
Oh,
well.
we're streaming. Okay, excellent. So I'll get going then. It's Mayor Nancy Peckford here, obviously. Welcome to North Grenville's YouTube channel. And today we are very pleased to feature Dr. Paula Stewart. She's the Chief Medical Officer of Health for the Leeds Grenville Lanark Health Unit. And she has certainly been the key person navigating the public health world, certainly pre-COVID and during COVID. So Dr. Stewart, thank you so much for being with us today. I know our community has a ton of questions. And really the first one, not surprisingly, is what's up with the cases? How are we doing? And what do you foresee? Obviously, we're all making a big effort to get those numbers down. So tell us what the status is as of this week.
Yeah, so actually we're doing quite well. You remember there were days when we were well up in the hundreds in terms of the active cases, and we're down at 55 today. And that's over the last 10 days. So there are 55 people who actively have COVID now, and so they would have developed it previously. So we're doing so much better than we were before. And a huge thank you to everyone who is following precautions, because that's what really makes the difference. And we don't have any people in hospital. Which is so good, because that's a sign of serious disease. And we haven't had any deaths this week. And when I've been reporting previously, we've had one death, and we've had 5 people in their 50s, 60s, 70s, and 80s. So really pleased, everyone following precautions is what makes a difference.
You've said 5 cases for the entire health unit, or is it for USLG, UCLG East?
55 for the whole
55.
health unit.
Okay.
Yeah, and so encourage everyone to go onto our website. That's where we put all the data up, and we're adding more and more to it. This week we're going to be adding a whole tab that looks at outbreaks, where they've been, and so on, which I think we've had a lot of questions about that. So please go to the website www.healthunit.org, and this is one of the tabs. This looks at very specifically for your region, how many active cases of COVID we had, and you're 15 today. And yours is an area where over time we have had more cases, and then they're settling down, and they're settling down a bit now. And that's very much because of the connection, the close connection you have to Ottawa. And Ottawa has much higher rates of transmission than we do in our region. And people who are working in Ottawa can potentially bring it back. So that's why I'm really pleased to be doing this with you today, because it's a time for me to say those public health precautions really work. They really do work. And so it's really important that everyone adheres to them. It'll protect you, your family, and the community as a whole.
Perfect. And Dr. Stewart, just to be clear, because it took me a while to figure this out, North Grenville is housed in that pink square, which is UCLG East. I think that's my understanding
exactly
of where we're.
Yeah, pinky purple. Yep, exactly.
Yeah, pink purple. And again, the case count as of today is for UCLG East
is 15.
15. Perfect. 15. So really quite a downward progression, which is what we wanted to see.
Yeah, because you and I have talked before, and there were numbers up in the 30s before. So
that's right.
And it's up to it's the result of what each and every one of us does.
So and we also have addressed in the past that our proximity to Ottawa, which I think in the past didn't seem to be as much of an issue, because we seem to be more stable in terms of our numbers. But with the COVID variants being more contagious and people still going into Ottawa for essential work, obviously, it looks like that was a factor in driving those numbers up when we talk about this third wave.
Yes, absolutely. And the thing about the covariance is that the virus is very clever. The virus changes as it replicates in order to become more effective at moving from person to person, because that keeps the virus surviving. And the covariants have found a way to change the spike protein, which is the part of the virus that pokes itself into the cell so that it can get inside it. And it is changed enough that it is much more easy to get the virus into the cell. Then it replicates more, so that means you have more virus in the back of your nose and your throat. And then when it comes out in the droplets, then obviously there's more virus there. And it means that if you're in close contact with someone who has the COVID variant, that there is more virus between the two of you. So that's why our numbers have gone up all across the province, and we've seen it here as well. And it just means you have to be really careful with the COVID precautions. You can't assume, oh, I've been with this person yesterday, it was okay yesterday, it'll be okay. It may not be. So you really, that 2 meters distance, wearing the well-fitting cloth mask is just absolutely incredible. And it starts with, if you have symptoms, please don't leave your house. That's really what it starts with. And we've had some outbreaks in your area and others where people thought, oh, they're mild symptoms, maybe it's not really COVID, gone to work, then it gets worse, they're tested, and then it's spread within the workplace. So yes, all of that is really important for all of us to remember.
So the minute you think you feel something coming on, sore throat, tickle in the throat, mild headache,
vomiting, diarrhea, it's like the COVID virus affects every part of our body. Yes, please stay home. And you have an amazing assessment center in Kentville. Like it's easy for people to go and get an appointment. We are getting results back within a day or two now. So you don't have long to wait. So that's great.
So it's really about picking up the phone, not worrying that you might be overreacting if you have any sort of symptom. That's off. Your body feels off. Take yourself to the COVID assessment center. Get that appointment. Online first, and then go to the assessment center. Okay,
you got it.
Well, that's a nice segue, Dr. Stewart, into how do people find vaccines? We certainly know, we're so proud that our assessment center was able to evolve also into a vaccination center. We know there's lots of people trying to access vaccines through the pharmacies. Some have been more successful than others, and I'm under 50, so I was one of those that had a shot at a pharmacy appointment, but they're really tough to get. Tell us where people can go if they're yet to be vaccinated, and will the eligibility change? And I know you don't have all that information, but what does it look like today? If you're listening to this, you are not vaccinated, what's your first step?
Yeah. So thank you for that. The province has opened up 50 plus as of today. They are steadily allowing more and more people to be immunized, so that their hope is that they're really down to 18 plus by the end of the month. So stay tuned to our website. We'll let you know the latest.
50 plus would be 50 plus is for the public health, right? Public health managed vaccination centers. So we're not talking pharmacies.
No.
Because the pharmacy eligibility is what now? So if you are under 50, what's the age range now?
Yeah, thank you. So pharmacies are 40, but honest to goodness, I don't know how much more vaccine is left in pharmacies. A wonderful response to the pharmacies having AstraZeneca. So there may be a little bit left you can try, but really it's our fixed sites now in it. So it's 50 plus. And
so at this stage, you're not expecting necessarily that a lot of pharmacies have much vaccine to work with for anyone between 40 and 50, presumably. Now, I understand that Ottawa, right, there was an announcement that in certain pharmacies in Ottawa, they might be opening up vaccines to a lower age range. People have, because we're so close to Ottawa, certainly a lot of people were trying to sign up, for a vaccine at a Costco pharmacy, right? Or some of the bigger pharmacies that were offering vaccines that are in a different health unit. What's the story there? Is anyone encouraged to go anywhere to get their vaccine?
Yeah, so it's complicated because the province has decided to designate some areas as hotspots, so that over time they're more likely to have COVID infections and more likely to have serious ones. And so for those very specific areas, and you have to live in that area to be eligible for the vaccine that is being given in those areas. And you're right, because we don't have a lot of AstraZeneca, then the province is experimenting with having the pharmacies actually use Moderna, which is one of the vaccines that we have and one of the messenger RNA vaccines. So they're seeing if they can actually put Moderna into those pharmacies, and then they can be giving that vaccine. It's really a matter of how well they can manage a more difficult vaccine. You're right, it's confusing, especially for your area, you're so close to Ottawa, but those hotspots are just to be for the people who actually live there. And
so you're really encouraging anyone at this stage, if they're on a wait list for a pharmacy, right? I presume they could still call and inquire in the event that there was any remaining vaccine. But what I'm hearing is, for the most part, if you're 50 and above, you should be calling to book your appointment at our North Grenville assessment and vaccination center. Is that correct?
Yeah, perfect,
Okay.
perfect. And you can, there are two ways to get it. You can actually go in through the provincial booking system, and the numbers are there.
Yes.
The link where you can, and then you go into that, you put your health card number, and then the available vaccine places come up, and you can choose one. If you're having trouble doing that, then we actually have a number that you can call.
Perfect.
That's the 1844 number that you see there. We have people that are answering the phone. We're really pleased that we'll be able to provide that service to our local community, and they are able to book into our vaccine clinics as well. So yeah, the municipality has done an amazing job of supporting public health through this. I really appreciate the support to be able to have a vaccine clinic that's so close to you.
It really has been a gift and a blessing, and we're very, very grateful, of course, for Dr. Rutherford's leadership and support on that, as well as yourself. So, of course, in saying that there is vaccine available at that center, of course, you can also, as you're saying, if you go to the provincial booking site, you'll see other sites that are available to you in the health unit. So it's not just our own vaccination center here in Kemptville that's available to you. There should be a number of options. Yeah, including in Ottawa. Like the province has said that anyone in Ontario should be able to book at any vaccine clinic. And so that you can, that's what's nice about going through the provincial system. You'll see other vaccine clinics in the Ottawa area or in Eastern Ontario, the Winchester area. Yes. So that they will let you know which ones have openings. And then you can choose from there. Huge advantage to go in through the provincial system. Great. And so, but when we talk about hotspot vaccines available through pharmacies, right, you're saying those are more designated for the residents or neighborhoods within Ottawa where there is a particular outbreak, as distinct from the vaccination centers that are run by the province or in cooperation with public health. Yeah, exactly. So they're run by Ottawa Public Health, just like run ours in collaboration. Exactly. Beautiful. Yeah. To be clear again, I apologize if I'm being repetitive. If you're in an essential job, but you're not in that first category of essential workers, but you are over 50, you can book a vaccine, right? Like your age makes you eligible. Exactly. But if you're under 50, as many are, working those essential jobs, you should check that list. And I see on our screen, we've got questions about eligibility, vaccine eligibility, and that's the site you go to on the health unit page to get that information. Yes, exactly. Okay. And you know, it's really, thank you for drawing my attention to this, because we've had people call and say, I don't have any way to get to the vaccine clinic. I'm in an eligible age group. And it's really, the community has rallied around to make sure that people don't have to not get the vaccine simply because they don't have a car or can't get around. So you can see the numbers there. In addition, if you are homebound and you're not able to leave your house, then please call that 1844 number, and we have a paramedic service where they will take vaccine to people who are homebound. As long as they're in the eligibility category. But now that we're at 50 plus, that'll be most people. So I think make sure that transportation isn't a barrier for you. Okay, transportation, and of course we know that the vaccination center here in North Grenville is open on weekends, right? I know time is another barrier, right? If you're working multiple jobs and you're overextended, do you want to? So I'm hopeful that flexibility, right, that's come with some of the pharmacy programs and with some of the weekend hours of our own vaccination center allow for those with very limited time to actually find their way to the vaccine. Do you have any interest in speaking to safety? I mean, it's all over the news, right? I know that, you know, for the most part, the AstraZeneca vaccine is expended. It's out there. It's in people's arms already. Is there anything you want to say in terms of vaccine safety, in case you have folks? We know that there are those out there who have a hard time accepting that. How could you develop a vaccine in a year? Where did that come from? What kind of miracle would have taken place, you know, to allow that to happen? So I'd love for you to say, you know, a couple words, if you'd like, on sort of vaccine safety. Yeah. So it really is, it's phenomenal. And the messenger RNA vaccine, so that's the Pfizer and the Moderna, they actually were built on cancer treatment.
that was using that part of the genome to be able to take vaccines into people. So to take treatment into people. So the researchers simply took that technology and said, hey, we could use that for vaccines. So that was clever. The AstraZeneca is using with vaccine technology that we've been using for pneumococcal vaccine, for meningococcal vaccine. So it's a very well-established way of providing a vaccine. And it's interesting what we're learning more and more about what the risk of thrombosis is. And it looks like there's an autoimmune, so that the body isn't recognizing some of the chemicals that are in the capsule around the vaccine that brings it into the body and says, hey, I don't recognize this, and develops this huge immune response. And it's an interaction between the platelets and that vaccine that is interrupting the normal clotting. So that it's a fantastic sort of science thing that everyone is understanding. That's probably way more than you wanted to know. The bottom line is that it's not very common, and it doesn't sneak up on you. So that if you're going to have a clot, then you're going to have a really severe headache. You're going to have chest pain. You're going to have abdominal pain. You're going to have pain in your legs. You're going to have they're discolored, and then you go to the emergency department. And the province has been really good about getting information about what the tests need to be done and how it needs to be treated. So I think it's a good vaccine. And I think that knowing what the possible symptoms are, you can react quickly and it can be treated.
That's really great information, because I think some people who've gotten it are worried that they could be struck with thrombosis and have no time to react. No. So I think that's a wonderful way of cueing people to what they need to look for. And it certainly was explained to me as well that the symptoms manifest, you seek medical attention, and it can be very well managed and very quickly. So go to your ER, to anyone out there who is experiencing any particular severe constellation of symptoms when it comes to a possible vaccine response. But of course, that's for AstraZeneca. And obviously at this stage, we're really looking at those Moderna and Pfizer vaccines now.
Yeah, that's right. In the clinics in the chemical clinics, it's the Pfizer vaccine that we're giving. The other thing, because you probably go a little bit beyond just your particularly your municipality, we are actually setting up community clinics as well. So planning one for Prescott that will be soon. And those are really for people who are living right in their geographic area. So we're not advertising them. Check with your primary care, with your pharmacy, more probably primary care in your municipality, for when the clinic might be coming to your particular area. Because if we advertise it, then potentially people will book from elsewhere. It's really meant for people right in their community, because not everyone has the luxury of having a vaccine clinic right next door like you do.
Okay, yeah, understood. So as we wrap up here, Dr. Stewart, I know there were some concerns about how safe it was to be outside. We're telling people to stick close to home, to stick obviously within their immediate family. There are no bubbles, as I understand it at this stage. You got to stick to your household, but you want to get outdoors. 30 seconds. Is it safe? Can you do it?
Yeah. So please get outside. Like your mind and your soul and your body actually need you to be out exercising. The critical thing is that you got to still keep the 2 meters away from people. That's what's critical, because we have seen spread between people outdoors who are really close together. So if you're outside, keep 2 meters away from people who aren't in your household, and enjoy it. Like it's a beautiful time of year, and nature does wonderful things for your mind. So please do get outside, enjoy nature. It's really important.
That's awesome. Well, we hope to continue these conversations. We know how much this kind of information really is of comfort, right, and of value to certainly residents here in North Grenville and business leaders. So thank you, Dr. Stewart. I know how busy you are. It's been really amazing that you can spend this time with us, and we look forward to another chat in a couple of weeks.
Yeah, sounds good. Happy to be doing it with you. Okay,
bye-bye. Stay well. Take care.